Hello everyone, this is Frank DiMora, and today is a special day because, first of all, it's great because it's the weekend. But I'm going to be giving you some news that is going to be tying in what the Lord warned about compared to what's going on in America today and what we know that's going to happen worldwide eventually. The warnings that Jesus gave to us for this planet, the last generation during our time. So it's critical that you understand what's going on, and let's take what we know from Scripture and then just observe what's going on in the news and put it together. Now, Jesus tells us in the book of Revelation, he says this in chapter 13, verses 16 through 17. And he causeth all, both small and great, rich or poor, free and bond, to receive a mark in the right hand or in their foreheads, and that no man might buy or sell, say he that had the mark or the name of the beast or the number of his name. So what this tells us is that a day is coming where the Antichrist is going to be marking everyone either in the hand or in the forehead. And without this marking, in other words, they're going to be going into a cashless society worldwide. Without this marking, you won't be able to eat, you won't be able to drink, you're not going to be able to buy, you're not going to be able to sell. It's obvious from what the Lord tells us, because he says it right there, that no man might buy or sell. So if you can't go to the grocery store to buy water, you're going to have to try to get water by yourself somewhere, or food, or medicine, or whatever it is. The government's going to X you out. And we know from Scripture in Revelation 24 that unless you take this mark, they're going to behead you. That's the warning that the Lord gives to us. And that is the warning to anyone who finds themselves in the tribulation period. Because this is a period that is going to be horrendous. We've never seen anything like this befall the earth, ever. That's what the Lord tells us. And unless he cut the time short, there wouldn't be anybody left when he came back. So knowing what the Lord tells us about this last generation, and by the way, the only generation who could even contemplate to do this now was the generation who got their hands on computers. It started with the simple ping pong game on your television sets. And then it went to what we see today, high advanced supercomputers, technology unbelievable, like no other generation has ever had. And Jesus showed us, and Daniel tells us about the generation of increased knowledge. It could be only this generation who could come out and produce systems that would be able to implant you one way or another, whether it be in your forehead or whether it be in your hand. And before I go even any further, anyone who does this, anyone who accepts this, Christ tells us that you'll be burning forever. And there's no hope for you to ever get out. So it's a message of importance for you, whether you believe it or not, because sooner or later, unless you die before these events take place, you're going to be faced with the decision, am I going to have to take this to live, or am I going to refuse it to die? That's a black and a white issue. That's what the Lord tells us. By the way, here you could look it up, but the Lord showed us in Revelation, he's going to send an angel out, warning people, don't take this mark. So let's move on. Now, many of you know who Ron Paul is. Ron Paul has been one of the candidates for President of the United States. And he is an honest guy. He's a doctor, a former doctor, very, very intelligent. And he is actually telling it like it is. Now, there was a bill that went before the United States. You'll see the 111th Congress, the first session. A lot of you know about this bill, but there's a lot of people who may know nothing about the bill. Now, this was instituted, as you can see, on July 14th of 2009. So you'll see the importance of why I'm putting Ron Paul up here is because obviously he's been warning about some of the things that are in this bill that many of you who haven't searched the bill may not know, and this is why I'm bringing this information out to you today. Now, you should know this bill failed to pass. It went out, they did a lot of work in it, but it did fail. Now, the proposed America's Affordable Health Choice Act of 2009, or as you can see here in the writing here, the H.R. 3200 was an unsuccessful bill introduced into the House of Representatives on July 14, 2009, like I just shared. But there's other information. I wanted to make sure that you saw it. So if you wanted to, you could freeze the frame. Now, the bill was introduced during the session of the 111th Congress as part of an effort of the Democratic Party leadership to enact health care reform, and the bill was not approved by the House, but was superseded by a similar bill, the Proposed Affordable Health Care for America Act, H.R. 3962, which was passed by the House in November of 2009 by a margin of 220 to 215. Important information, at least you'll understand the concept of what's going on. This H.R. 3200 was unsuccessful. And then he went on to pass another bill. Now, as I said, Ron Paul made statements about the first bill, the H.R. 3200 bill. Republican Congressman Ron Paul from Texas states on his website, and if you go and you do a research on it, I'm not sure if it's still going to be there or not, but this is what he said. Buried deep within the over 1,000 pages of the massive U.S. Health Care Bill, the PDF, in a non-discussion section entitled Subtitle C11, Section 2521, National Medical Device Registry, and which states its purpose as, he quotes, that part of the law then goes on to say, in real-world speak, according to this report, this new law, when fully implemented, now get this, when fully implemented, all right, not partially, but when it's fully implemented, this is a very important word that he put there. When it's fully implemented, provides the framework for making the United States the first nation in the world to require each and every one of the citizens to have implantable in them a radio frequency identification microchip for the purpose of controlling who is or isn't allowed medical care in their country. So, as I said, only this generation would be able to even come up with the device that they're talking about. Now, as I said, this particular bill failed, but they went on and they did pass bills, by the way. The new bill that they were working on was the H.R. 3962, and this was October the 29th, 2009, as you can see right here. It said to provide affordable, quality health care for Americans and reduce the growth in health care spending and for other purposes. Just highlight these words, if you will, these other purposes, because there are other purposes, I think, that they're trying to skirt around. And I believe that when the process goes to fruition in its entirety, like Ron Paul said, that eventually everybody's going to have these chips. And I'm going to show you how. So here's the bill, July 14, 2009, the H.R. 3962. And I'm going to have links at my website. I'll have independent links that you can click these links and you could read all of this information. You could read all the bills that I'm showing you here at the YouTube channel today. So as you can see on the left here, you see what I did is I shrunk it down for you, 3962. This is the bill that I was talking about. Now this is page 1001, the subtitle C, National Medical Device Registry. Very important information here. All right? National Medical Device Registry. This is where it gets pretty good. Now, the Secretary shall establish a National Medical Device Registry in this subsection referred to as the registry to facilitate, analyze the post-market safety and outcomes data on each device that, and here you see A, is or has been used in or on a patient. Notice the in. Has been used in or on a patient. Now keep in mind what the Lord told us about having this mark in your skin or in your forehead. All right? Now, let me go on to the next page here. And you'll see again, this is the same page that I was reading from, the 1001 page from the National, this National Medical Device Registry. Now here's page 102. And you'll see under B it says this. B is I, a class 3 device, or I, a class 2 device that is what? Look at this. Implantable, life-supporting, or life-sustaining. It says, in development the registry, the secretary shall, in consultation with the commissioner of Food and Drug Administrator of Center of Medical and Medicaid Services, the head of the Office of the National Coordinator for Health Information Technology, and the Secretary of Veteran Affairs, determine the best method. So, the important part right here is the device. There's two devices, a number 3 device and this class 2 device, which is able to plant in your body. Implantable. All right? So I'm just trying to make you understand what's going on here. Follow with me if you can, because this implantable is very, very important, especially when you're connecting the dots to what Jesus Christ said about Revelation chapter 13, and they're going to put a mark, obviously, in your right hand or in your forehead. Now, knowing that H.R. 3962, this was the October 29, 2009 bill. This is the new rewritten bill, all right? Now, the new rewritten bill looks like this, because what they did, very, very sly, and I'm going to be showing to you, but look what it says here in number 15, where you see that arrow. It said may include. Remember when it said this in this subsection, the term covered device shall include each class 3. They left that there. And now look what it says. May include. Now the terminology in this bill, what they did in this particular instant was very, very vague, wide open. It can mean anything. May include this. God only knows what it may include. May include as the secretary determines appropriate and specifies in regulation a class 2 device that is life-supporting or life-sustaining. Now, what if down the future, when this health care is fully implemented, say for example that there is an HN, one of these bird flus, influenza, whatever, and it starts to spread like wildfire. What if that happened? Could it be that the United States government would mandatory an implanted chip, put this implantable chip in, saying that you need it for detection of this disease? They needed it to keep everybody safe, and it would be mandatory. It would be mandatory, and it would go where? Obviously, it would go in the skin. That's one of the things that is very possible to happen, especially when you're talking about where this arrow is, may include. Like I said, only God knows what they're going to be including in this thing. But the fact of the matter is, they're talking about this class 2 device. This life-supporting or life-sustaining device. Now, as I said, when you take a look, this is the old bill. This class, as I was just reading to you, the class 3 device, or 2, as you can see right here, the class 2 device that is implantable, life-supporting, or life-sustaining. Now, take a look at the new bill, which was passed, and this is on page 1502 of the bill. Now, in the old bill, like I was showing you, there it is, implantable. Now, in the later bill that you look over to the right-hand side, you'll see the writing that I put up for you. Hopefully that you saw that. And I did this so that you take a look. And they took out implantable and replaced it with may include. I'm saying this again so it sticks in your head. It's there. May include. Now, like I said, they were just slightly modified. They take out implantable and they put this other word in there, may include. But let me tell you something. It's the same exact thing. They're not getting rid of it. All they did was take out a word. And they're making it look like, because obviously there was a lot of people that were upset about this implantable. A lot of the Christians around the world, I know because I watch the internet and I read the news and I hear people talking and I get people asking me questions when I go into my live interviews or my live presentations. They want to know about the implantable portion, and they were upset about it. So I'm sure this is one of the reasons why they took it out, but it's still there as may include. It hasn't changed. It hasn't gone away. Now, the end result of the final bill turned out to be the H.R. 4872 bill. And you'll see it's the same Congress, 111 Congress, the second session. And of course, this came out of March 17, 2010. This was the final bill that passed. Now, on March 17, 2010, you see the National Registry. Take a look. National Medical Device Registry. Now, in this final bill, you'll see that it did pass, right? And look at it. Look what they have in the final bill now. They took it out of the other bill, and now it's back. Take a look. Right there in number 15. Class 3 device or to a Class 2 device that is implantable, life-supporting, or life-sustaining. So it was in the first bill, and then it got taken out. Changed the words. Now it's back. So there you have it. Implantable. So what are they talking about when they talk about this implantable? Well, I know that Obama's pretty happy about it. He got the health care passed. This is what this bill is that I just showed you the arrows on it. But is it really a good thing? When they're talking about implanting you, I don't think it's good at all. Now, there's a lot of people who went into Snoops and to check this out. And I wanted to bring this to your attention as well. I mean, you can go to Snoops if you want and read it. So this is what it looks like. Microchip off the block. It says, claim that the health care legislation requires that the U.S. residents be implanted with an RFID microchips. And of course, for those who don't know, this is radio frequency identification. So according to what the Snoops.com said, it was false. And they gave us an example of it. It says Obamacare law requires an RFID chip implanted in all of us. Are you ready to have the RFID chip implanted? They give you a date here. Look at the date. This would be March the 23rd, 2013 is your date. This new healthcare Obamacare law requires an RFID chip implanted in all of us. This chip will not only contain your personal information with tracking ability, but it will also be linked to your bank account. And get this, page 1004 of the new law dictating the time of this chip reads, and I quote, not later than 36 months after the date of enactment. It is now the law of the land that by March the 23rd, 2013, we will all be required to have an RFID chip underneath our skin, and this chip will be the link to our bank accounts, as well as to have our personal records and tracking ability built into it. Now, there is the link to the Snoops where there was writing it, but let me just point out something here in yellow, and I caught this. Now, in the new bill, you're not going to see any dates, and obviously whoever said this, they didn't get this right, because the March 23rd, 2013 date has come and it's gone. There hasn't been any implementation. Everybody in the United States hasn't been forced on this. So that is false. Obviously, that's false. The date is false, and that's why I put it in yellow. But when they're talking about implantable devices, that's a whole different story. The date that they are saying in this article, whoever wrote that, They're saying that that was false. That is the truth. It never came out as March 23rd, 2013. But however, there is implantable devices that are still in the bill. Now, what is a medical device? Now, I'm going to show you the FDA. This is the U.S. Food and Drug Administration. And you'll see right there, medical devices. The guidance for the industry and the FDA staff. Class 2, special controls, guidance, document. Now get this, implantable radio frequency transponder system for patient identification and health information. So what is the FDA showing us? It's an implantable radio frequency transponder. In other words, you can have this little device, these little chips in your hand, and they will be able to monitor everything about you, including where you are and all the medical records and everything else about you. This is the FDA, the U.S. Food and Drug Administration. This is important information so you will understand how it's all being connected. Now look at what the FDA calls a Class 2 device. Implantable radio frequency. Plant this into your head for the near future. Now, in their website, this is what it says. And again, I'm going to have the links for you. And since I already read the top, I'm just going to go right here, starting with this background. It says, this guidance document was developed as a special control guidance to support the classification of the implantable radio frequency transponder system for patient identification and health information into Class 2 special controls. Now here you go, the device. Remember in the healthcare, bill, the device. Look at it. The device is intended to enable access to secure patient identity and corresponding health information in humans. This guidance is issued in conjunction with the Federal Registry Notice announcing the classification of what? Look, implantable radio frequency transponder system for patient identification and health information. In other words, a device that would be able to transmit all the information. Where's it going to go? It could go in your skin, obviously. Now, this guidance document describes a means by which implantable radio frequency transponder systems for patient identification and health information may comply with the requirement of Class 2 special controls. Designation of this guidance document as special control means that manufacturers of implanted radio frequency transponder systems for patient identification and health information who follow the recommendations listed in this document before introducing their device into commercial distribution in the United States will also be able to market their device, now get this, very important, without being subject to the pre-market notification requirements of Section 510K of the Act. In other words, they're not going to be held accountable if they do this before it goes into effect without being subject to the pre-market notification requirements as Section 510K of the Act. Now, Section 510M of the Act provides the FDA may exempt a Class 2 device. This is the device they're talking about in the health bill from the pre-market notification requirements under the Section 510 of the Act of FDA determines that the pre-market notification is not necessary to provide reasonable assurance of the safety and effectiveness of the device. FDA has determined pre-market notification is not necessarily to provide reasonable assurance of the safety and effectiveness of the generic type of device if the manufacturer follows the recommendations in the special controls guidance and equivalent measures to address the risks identified in the guidance. Thus, persons who intend to market a device of this type do not need to subject a pre-market notification to FDA and receive agency clearance prior to marketing the device. But as a Class II device, the device must comply with other applicable general and special controls, Section 513A(1)(b). So there you have it. You have this implantable device that the people who are making it for have a way out. All they have to do, as you can see it right here, is just pre-market it. FDA will approve it. Now, who are the people responsible for making these kind of things? Well, take a look here, if you will. This is the Veritique Unique Device Identification, UDI. This is the UDI that is in the bill. And who do you think makes these things? It says, the Veritique question, inside safety technology for unique device identification, UDI, includes an FDA cleared. See what I'm talking about? They're intermingled. You have the people who are making these chips. They've been cleared to do this, to put these things in your body, to be cleared. Passive RFID microchip, proprietary handheld scanner, and a database. So in other words, let's look at it this way. You have this implantable chip, or when you take a look at this video here, you'll be able to see that this chip is smaller than a penny. And now it's obviously, if you've been watching the news, it's smaller than a grain of rice. All right? It can be implanted anywhere. And so let me go over, now that you know that Veritique is in the business of making these things that put into you, let's read what it says. Now again, keep in mind you're going to have the links and you'll be able to read right at their links. Implantable medical device identification, Veritique's question. Inside safety technology can also be used within implantable medical devices such as breast implants, vascular ports, and artificial joints, among others. And to keep in mind, when we're talking about among others, we'll have to bring in a little bit of information for you, including, question, inside of implantable medical devices helps ensure rapid and accurate access to device data, i.e. serial number. Now, when I read that, and I read Revelation chapter 13, where it says his number, the number of a man, it's going to be a number, right? So obviously, when you have a device that is able to go in your hand or in your body, and it has numbers, just put two to two together, and you'll see that we're on the path to fulfill Revelation chapter 13, the warning about the Antichrist, his mark that will be coming. So, the serial number, lot number, batch number, they're all numbers, right? Isn't this what the Lord told us to watch for? The number of his name. Now keep in mind, when it's full blown around the world, it will be the Antichrist who issues this, who enforces this. Very important message right there. It will be the Antichrist who tells everybody you have to do this. It won't be just America. It'll be all over the world, which may be potentially life-saving in the event of a product recall or when an adverse, and this is where I just cut it off, but, excuse me, now when I talked about these other, among others, it could be anything at all. You're talking about artificial joints, but what it could about, if you're going to be going in, say, to get medicine, special medicine. Is it possible that they'll have to use this to monitor their special medicine? You better believe it. Could be anything in the health industry that they put into your body. Just think about it. prosthesis, a new lung, a new heart, only God knows. But if they're talking about products that can be recalled, it could be anything that they put into your body, and it could be a host of different things. And remember in the bill that I told you when it said other things? Well, hey, let's take it for what it is, other things. Now, just to show you that in my book I talk about VeriChip. Now, VeriChip is the company, obviously, that came out a long time ago, and they are using this chip for medical purposes. Using it for cases, for example, of Alzheimer's. That's one good example of it, where they can chip an elderly person who gets lost, and they'll be able to track them down. All right, now, a lot of people don't know this, but when you take a look at this business wire, Veritech or Veritique Acquisition Corporation acquires implantable FDA cleared VeriChip technology and HealthLink personal health records from Positive ID Corporation. So you have VeriChip turned into Positive ID Corporation, and now they are the offshoot of the Veritique. It's the same people producing these implemented devices that will be placed in the bodies. Required to do this. The Veritique Acquisition Corporation, you see the markings there, a marketer of implantable radio frequency identification RFID technologies for patient identification and sensor applications, announced today it has acquired VeriChip implantable microchip and related technologies and HealthLink personal health record from Positive ID Corporation. Veritique is majority led by Scott R. Silverman, former chairman and CEO of Positive ID and VeriChip Corporation. Positive ID has retained an ownership interest in Veritique. So there you have it. You have this entity is growing, but they're really doing the same thing. It's the same people doing essentially the same thing. And what I mean by that, medical devices, implantable devices in the body. Now, let me bring you over to look at this, the National Medical Device Registry. All right? The UDI sent to the medical registry. FDA proposes unique device identification system for the medical devices. Congress passed legislation in 2007 directing the FDA to develop regulations establishing a unique device identification system for medical devices. On July 3, 2012, only 5 years after the initial direction, the proposed rule was sent to the Federal Register for publication. What are the benefits of the unique device identification when fully implemented? Look at this. When fully implemented, the UDI system may allow more accurate. And then when you go into the website, you see, when you get to the website, if any of you want to check this out for yourself, all you're going to do is go over to the link right here, and then you'll see this little arrow. Click the link, and you'll be able to go inside and read what's in it. And so one of the things that are going to be coming up, it says, what is UDI? Let's take a look. The Unique Device Identification UDI system is intended to assign a unique identifier to medical devices within the United States. It was signed into law September 27, 2007 as part of the Food and the Drug Administration Amendments Act of 2007. This act includes language related to the establishment of the Unique Device Identification System. Now, when implemented, the new system will require the label of a device to bear a unique identifier, unless an alternative location is specified by the U.S. Food and Drug Administration (FDA) or unless an exception is made for a particular device or group of devices. The unique identifier to be able to identify the device through distribution and use. The unique identifier to include the lot or serial number if specified by FDA. A national UDI system will create a common vocabulary for reporting and enhance electronic tracking ability. So if the Antichrist wanted to track you, he'd be able to track you wherever you were. He'd be able to understand everything about you, about your health records, about any record that they want to put in these devices. So currently, analysis of the adverse event reports is limited by the fact that the specific devices involved in an incident are often not known with the required degree of specificity. And without a common vocabulary for medical devices, meaningful analysis based on data for exiting voluntary systems is problematic. Reliability and consistent identification of medical devices would enable safety surveillance so that the FDA and manufacturers could better identify potential problems or device defects and improve patient care. The UDI is expected to improve patient safety, in part by helping to identify counterfeit products and by improving the ability of staff to distinguish between devices that are similar in appearance but serve little or different functions, facilitate and improve the recall process, and create efficiencies within the medical system. So going back, the warning with the Republican Congressman Ron Paul, we know that the legislation is now passed. Barack Obama's pretty happy about it. And now the United States is well underway of seeing this program come into fruition. There was a warning by serious men in Congress. Ron Paul, very educated, very smart man. And he's warning Americans about this technology that's hidden in this bill. And a lot of people don't even know about it. But a lot of people should know about it. And a lot of people should get upset when they're talking about putting these devices inside your body to keep track of what's going on. So, let's take it one step further. Yes, they say, okay, you're going to start signing up now for the health care bills. One at a time, 10 here, 20, 30, 1,000, 10,000, 2 million, whatever they are, Americans around the world or Americans abroad will if they have it, if they're coming back into the United States, and Americans who obviously live in the United States will be under this implemented device that's in the bill that most people don't even know about it. And depending on what it's used for, whether it's used for a heart transplant, another leg, an arm, a lung, who knows? But if they're saying that they're going to be tracking these devices, they always start off by looking like it's really good. But the end result is terrible. What's the end result? Obviously, the end result is what? The end result filters down to what Jesus told us about it in his prophecy. Now, all we can do is look at what is in the bill. We see what's in the bill. We see that it is a product that goes in the skin. Jesus talks about a mark that will go into the skin. We look at the healthcare system. And now the United States is mandatory. Everybody has to get on it. Because if you don't get on it, what happens? You get penalized. You get fined. And the people, if they're fined constantly, they're going to be forced to get on it. So it's mandatory for everybody. except for maybe those rich people who can afford not to pay the fines that you're going to get if you don't sign up for health care. But the bottom line is the direction that America's going with these devices in this health care bill, when it's fully implemented, they could do whatever they want and force anybody in the United States to do exactly what they want. And if you don't do it, what happens? Well, they can jail you, they can fine you. And we know eventually what's going to happen when the Antichrist controls this system worldwide. It doesn't have to be a medical system, but it will be an advanced system where the Antichrist controls everything with this mark or the number of his name. As it says in Revelation 13, receive a mark in the right hand or in the foreheads. No man might buy or sell that he had the mark or the name of the beast or the number of his name. And so, without jumping off the deep end here, all I'm saying is this. Look at what the Lord warned and look what they're doing. And if it looks similar, and it certainly does in this case, and what is happening is coming at a time where only our generation can do it, then when you put these things together, you have to formulate something in your mind, and that is Jesus telling us the truth? The things that we're seeing, are they coming to fruition? And without a doubt, I can say yes because I've searched the scriptures. I've been watching the news ever since I was a born-again Christian in 1977. I've been on the watch, watching for these signs to happen. This is what the Lord told us to look for. It was a command. And so, if you live in the United States and now you're under Obamacare, all I'm going to say is this. You don't have to believe anything that I'm telling you. I've given you the resources. I'm going to give you the links. When you go to my link or my website, click the links and read the information for yourself. Just be observant and watch, because this is what Jesus said. Keep on the watch. And down the line, if you start hearing that you got to get this chip, but keep in mind they had the date wrong. I showed you to you here, March 23rd, 2013. That was false. Now, whether that date was true or false, to me it really doesn't matter. The thing that matters is what's going to happen down the line here. Will it turn out to be true and a different date? That is remain to be seen. Understand the scriptures and watch what they do. And if you see it happening, get down on your knees and ask Jesus Christ for forgiveness, because there are definite signs that Christ is coming, and the Antichrist has to come first. He will be revealed, no doubt about it. He's going to be revealed. We know that from Paul the Apostle, when he talks about the Antichrist being revealed first, and then we which are alive and remain are going to be caught up to heaven. And speaking about the Antichrist, look what Paul warns us. All right, so as long as I mentioned Paul the Apostle in talking about the Antichrist coming, look what he says in 2 Thessalonians chapter 2, verses 1 through 3. And it's talking about the great apostasy. He says this, "Now, brethren, concerning the coming of our Lord Jesus Christ and our gathering together to him, we ask you not to be soon shaken in mind or troubled, neither by spirit nor by word or by letter, as if from us, as though the day of Christ has come. Let no man deceive you by any means, for that day will not come unless the falling away comes first and the man of sin is revealed, the son of perdition." So I'm going to be honest with you. Verse 3 has been a tug of war for a lot of Christians. But the fact of the matter is, he does say this, "Let no one deceive you by any means, for that day will not come unless the falling away comes first and the man of sin is revealed." So it certainly looks like the man of sin is going to be revealed before the church goes. And there's a lot of theology going out now that this will happen in the middle of the tribulation. Well, I will just say this, because to me it really doesn't matter. If you're a Christian, you should be ready to do whatever the Lord has for you. And I pray constantly about that. Being ready no matter what, whether it's in the beginning, the middle, or whatever. We know that it's not going to be in the end, but it is possible that it may be in the middle, as the Lord shows Paul. Will not come unless the falling away comes first and the man of sin is revealed. So I'm hoping that this will at least encourage you to start looking in the news, and it'll encourage you to do investigation for yourself. Be like a Berean, like we see in the New Testament. The Bereans checked everything that Paul was saying. They were blessed because of it. But unlike the Bereans, we are in the last generation. So it should behoove you to be motivated to find out for yourself whether the things that you are seeing are true. And the only way that you could do that is to check for yourself. Now, I know America, the Americans, have become really lazy and apathetic when it comes to studying the Word of God. I see this everywhere I go. You can ask questions. You can see that people don't know anything about the Bible or very little about the Bible. And I'm not saying this to condemn anyone. I'm just saying it's a product of the condition of the last days. People are moving away from Christ. They're moving away from sound doctrine. All of these things were warned by the Lord. And they're all happening in one generation. So let this be an encouragement. Let this be an invitation, if you will, to start looking. Start observing. Give the Lord a chance, because if you know the Word and you look out there and you're watching the news, you know why I'm on my face praying daily, asking the Lord to forgive me for no matter whatever I do, so that I can always be ready for when He comes, because He is coming. And our generation has been the chosen generation to see that happen. God bless.